Welcome to another deep dive, everybody. Today, we're going to be exploring something pretty amazing.
Yeah.
A newborn's transition from the womb to the world.
It's pretty incredible, isn't it?
It really is. Especially for,
Yeah.
nursing students and faculty who are
Right.
caring for these little ones. It's essential to understand those first few hours and days.
It really is a
Complete
complete
transformation.
It is. And, one of the most critical periods
Absolutely.
is that first hour after birth. We call that the golden hour.
Yeah, the golden hour.
I've read that it can really make or break a baby's
Yeah.
adaptation to life outside the womb. So why is that first hour so important?
Well, think about it this way. For 9 months, the babies relied completely on mom.
Right.
For everything. Oxygen, nutrients, waste removal, keeping warm.
Yeah.
But then suddenly the umbilical cord's cut.
Right.
And all those systems have to start working on their own immediately.
So there's a lot that has to happen in that golden hour.
Oh, absolutely. Can we break it down into
Yeah.
the main things that need to happen?
Well, you can think of it as like 4 major transitions.
Okay.
You've got the circulatory system, the respiratory system, thermoregulation,
Okay.
and then stabilizing blood glucose.
Okay. Wow. So all these systems are working together
All interconnected. Yeah,
and each one's playing a really vital role.
absolutely.
So let's start with the circulatory system I remember from anatomy class.
Yes.
That the heart has 4 chambers,
Right.
but in a fetus, there are these openings in blood vessels
Yeah.
that allow blood to kind of bypass the lungs.
Right, because they're not using their lungs to
Yeah.
breathe. They're getting oxygen from the placenta.
Exactly. So
Yeah.
once the baby's born and takes that first breath,
Yes.
those bypasses the shunts.
Right.
They need to close.
Yeah,
And the blood flow needs to be redirected to the lungs.
that's right. It's a big reroading project.
Yeah. It's like changing all the roads in a city overnight.
It really is. And it all boils down to pressure. When the umbilical cord's clamped,
Right.
the blood flow from the placenta stops.
Okay.
And that increases pressure on the left side of the baby's heart.
Oh, I see. And at the same time, the lungs inflate with air,
Exactly.
and that decreases the pressure on the right side of the heart.
You got it.
So it's like a push and pull effect.
It is. And that pressure difference is what forces those shunts to close.
Wow. And then all the blood starts circulating through the lungs.
Exactly. It's
Yeah.
really quite amazing how efficiently it happens.
It is. Now, while we're talking about the umbilical cord,
Yes.
there's this whole debate about delayed cord clamping.
Yes. That's right.
Clamping early versus clamping late.
Big topic.
So what's the latest thinking on that?
Well, the American Academy of Pediatrics, the American College of OBGYNs,
Okay.
and even the World Health Organization,
Wow.
they all recommend delaying clamping
Okay.
for at least 30 to 60 seconds, sometimes even longer.
Oh, wow. And why is that?
Well, that extra time allows more blood to flow from the placenta to the baby.
Okay. Which increases their blood volume and their iron stores.
Oh, I see. So that can help prevent anemia.
Exactly.
Okay.
Especially in premature babies.
That makes sense. Now, I know there's been some concern about
Yeah.
possible risks with delayed clamping.
Right. There have been some concerns about increased jaundice,
Okay.
but for most healthy full-term babies, the benefits seem to outweigh the risks.
Okay. So it sounds like delayed cord clamping is generally a good thing.
Yes, for most healthy babies, it's becoming the standard of care.
Okay. So we've talked about the heart rewiring itself. Now, what about breathing? Before birth, the baby's lungs are filled with fluid.
They're basically swimming in amniotic fluid.
Right.
Right.
So how do they make that transition to breathing air?
Well, during labor and delivery, some of that fluid gets squeezed out
Okay.
as the baby goes through the birth canal,
Right.
but the rest of it needs to be absorbed.
Right.
And those tiny lungs have to start working,
Yeah.
taking in oxygen, releasing carbon dioxide.
So what triggers that first breath? It's amazing, actually. It's a combination of things.
Okay.
Changes in pressure, temperature, and even blood chemistry.
Wow.
When the baby comes out into the world, that sudden drop in temperature
Right.
and the increasing carbon dioxide levels in their blood,
Okay.
it signals the brain to start breathing.
Wow. It's like a wake-up call.
It really is.
Now, besides breathing, another vital function is staying warm.
Absolutely.
Babies are so much more vulnerable to heat loss than adults.
Right. They have thinner skin,
Okay.
a larger surface area compared to their weight,
Yeah.
and they can't shiver to generate heat.
Right. And they're still building up their brown fat.
Yes. That's their special way of keeping warm.
I was reading about a new mom who was worried about her baby being all bundled up
Yeah.
in the summer. Seems like we need to find that balance
Absolutely.
between keeping them warm but not overheating them.
You've got to find that sweet spot.
So let's talk about the ways babies lose heat.
Right.
Because I think that's really important for nurses to understand.
Absolutely. There are 4 main ways.
Okay.
Conduction, convection evaporation, and radiation.
Okay, so conduction. That's heat loss through direct contact.
That's right, like with a cold surface.
Okay.
So like a cold scale or a stethoscope.
Oh, that's why we pre-warm surfaces and use warm blankets.
Exactly.
And then convection. That's heat loss to the surrounding air.
Right. So drafts and cool breezes can really chill a baby quickly.
Okay, so keep those isolettes away from drafts.
Yes,
Yeah.
definitely. And then there's evaporation,
Okay.
which is heat loss through moisture.
Okay.
So drying babies off quickly after birth or back is really important.
Makes sense. And then radiation.
Radiation is heat loss to cooler objects nearby,
Okay.
even if they're not directly touching the baby.
Oh, I see. So like being near a cold window.
Exactly. It's something we might not always think about.
Yeah, I never really thought about that.
But it's important to be aware of all these factors.
Yeah, it really is. And of course, one of the best ways to keep a baby warm
Yes.
is skin-to-skin contact with the mother.
Absolutely. It's so simple, but so effective.
It's amazing how nature provides that perfect solution.
It really is.
We also use warming blankets, hats, and radiant warmers.
Right, when needed.
But it's all about understanding those mechanisms of heat loss
Yes.
and applying them in practice.
To keep that baby's temperature in a safe range.
Right.
That's the goal.
Exactly.
Yeah. Okay, so we've talked about those big immediate changes after birth.
Right.
You know, the circulation, breathing, temperature.
Yeah.
But let's zoom out a bit and look at how all the other systems are adapting.
Okay, yeah. It's a lot for that little body to handle.
It is. And
Yeah.
we see some bumps in the road sometimes.
Okay, like what?
Well, one area is the hepatic system.
Oh, right, the liver.
Yeah. Specifically with bilirubin conjugation.
We talked about jaundice earlier.
Yes.
Can you remind us why newborns are so susceptible to that?
Sure. Before birth, the mom's liver handles most of the bilirubin processing.
Right.
But after birth, the baby's liver has to take over.
Right.
And it's a bit slow to catch up. Those pathways for breaking down and excreting bilirubin,
Yeah.
they're just not fully developed yet.
So that's why we see that yellowing of the skin.
Exactly. That's the jaundice.
And most of the time, it's just a normal part of the transition.
Right. We call it physiological jaundice.
Okay.
Usually it resolves on its own.
Okay.
But we do need to watch for those cases where it could
Okay.
be something more serious.
So what kinds of things?
Well, like blood incompatibility between mom and baby.
Yeah.
Or a liver disorder.
So that's something nurses really need to be aware of.
Absolutely. Early detection is key.
Okay, now what about the gastrointestinal system?
Oh, another big adjustment.
Right, going from the umbilical cord to actually digesting milk.
It's a huge change for their little gut.
And their digestive system's not fully developed yet.
Right, those enzymes aren't quite there yet.
Yeah.
And their stomach is tiny.
So small, frequent feedings are important.
Absolutely. And we also need to remember that the gut isn't sterile at birth.
Oh, right. It's got all those bacteria.
Exactly. And those bacteria are really important for digestion and immunity.
So that's why newborns are more susceptible to infections.
That's part of it. Their immune system is still developing.
Right.
They get some antibodies from mom.
Yeah, especially if they're breastfed.
Right. But it takes time for them to build up their own defenses.
So protecting them from infection is really important.
Absolutely. Hand washing, sterile technique, limiting exposure to sick people.
All the basics.
It's essential.
Okay, so we've got the liver, the gut, the immune system.
Yeah.
What about the nervous system?
Well, we talked about those reflexes earlier.
Right.
And those are a good sign that the nervous system is developing.
Okay, what else should we look for?
We look at their muscle tone,
Okay.
their movements,
Right.
their responses to stimuli.
So, like, are they moving all their limbs equally?
Exactly. Are they reacting to sounds and lights?
Okay, and what are some red flags?
Well, if they're excessively jittery or floppy,
Okay.
or if they're not responding to stimuli, that could be a concern.
What about sucking and swallowing?
Yes. If they're having trouble with that,
Okay.
it could be a sign of a problem with their cranial nerves.
So we need to watch them carefully.
Absolutely. We're looking for those subtle cues
Right.
that tell us how their nervous system is doing.
Okay, now their skin is also really important.
Yes, it's so delicate.
Right.
Much thinner and more permeable than an adult's skin.
So that makes them more prone to irritation.
Exactly. And dryness and infection.
So gentle handling is essential.
Absolutely. And using the right products on their skin.
Yeah, no harsh soaps or lotions.
Right. We don't want to disrupt that natural skin barrier.
Okay, so We've talked about some of the challenges newborns face.
Yes.
What can nurses do to help them through this transition?
Well, first and foremost, we need to be vigilant observers.
Well,
We're constantly assessing their vital signs, their behavior, their overall appearance.
right.
We also need to be skilled in providing supportive care.
Okay, like what kinds of things?
Well, keeping them warm,
Right.
assisting with feeding, protecting them from infection.
Right.
And just as importantly, we need to be excellent educators.
Oh, yeah. Teaching the parents how to care for their newborn.
Exactly, and how to recognize any signs of trouble.
So it takes a lot of different skills to be a good neonatal nurse.
It does. It's a combination of knowledge, compassion, and communication.
Yeah. It sounds like a really rewarding job, though.
It is. It's a privilege to care for these tiny humans at such a crucial time in their lives.
So going back to those circulatory changes,
Yes.
we talked about how the baby's heart basically rewires itself.
It really is a remarkable transformation.
It is. Can we go through those changes again in a little more detail?
Sure, it's worth emphasizing just how incredible this process is.
Yeah.
So let's start with fetal circulation.
Okay.
Imagine the baby's circulatory system as like a network of roads.
Okay.
And before birth, there are these detours and bypasses that are designed to get oxygenated blood from the placenta to the baby's organs.
So it's like a temporary traffic system.
Exactly.
That works perfectly in the womb.
Right, but it needs to change once the baby is born.
Okay, so why are those detours necessary before birth?
Because the baby's lungs aren't functioning yet.
Right.
The placenta is doing the work of oxygenating the blood.
Okay.
So the blood needs to bypass the lungs.
Okay, and that's where those shunts come in.
Exactly. The foramen ovale and the ductus arteriosus.
Can you remind us what those do?
So the foramen ovale is an opening between the two upper chambers of the heart.
Okay, the atria.
Right? And it allows that oxygen-rich blood from the placenta to bypass the right ventricle and flow directly to the left atrium and then out to the body.
So it's like a shortcut for the good blood?
Exactly.
Straight to the brain and the other vital organs.
That's it. And then the ductus arteriosus is a blood vessel that connects the pulmonary artery to the aorta.
Okay.
And that allows any blood that does go to the right ventricle to bypass the lungs and go directly to the aorta and then out to the body.
Okay, so we have these shunts working great before birth.
Yes.
But then when the baby's born, everything has to change.
Right, and it happens really fast.
So what happens?
Well, when the baby takes that first breath, the lungs inflate.
Right.
And the pressure in the pulmonary circulation drops.
So the blood can flow through the lungs more easily.
Exactly.
And then the umbilical cord is clamped.
Right.
So the blood flow from the placenta stops.
Exactly. And that causes the pressure on the left side of the heart to increase.
Okay, so we have lower pressure on the right and higher pressure on the left.
Precisely. And that pressure difference is what closes the foramen ovale.
Oh, wow. So it's like a door that slams shut.
That's a good way to think about it.
So the blood can't flow back to the right side of the heart.
Exactly. It's all going to the lungs now.
And what about the ductus arteriosus?
Well, as the baby breathes and the oxygen levels in the blood rise, the ductus arteriosus starts to constrict, and eventually it closes completely.
So it's the oxygen that triggers that closure.
Exactly.
And there's one more shunt we need to talk about.
Oh, right. The ductus venosus?
Yeah, what does that do?
Well, it bypasses the liver during fetal life.
Okay.
But after birth, it closes.
Okay.
And that allows blood to flow through the liver for filtering.
So all these changes happen really quickly.
They do. It's amazing.
It's like a symphony of physiological changes.
It really is.
All perfectly coordinated.
To support the newborn's transition to life outside the womb.
It's mind-blowing.
I know. It's one of the most fascinating things about this whole process.
Well, I think we need a moment to process all of this.
Yeah.
How about we take a break?
Sure.
And come back and explore those newborn reflexes.
Yes, good.
And behavioral patterns.
Okay.
Welcome back, everyone. We've been talking about the amazing transition newborns make from the womb to the world.
It really is incredible how much happens in those first few days.
It is. And you know, those reflexes, they might seem simple.
Right.
But they can tell us so much about a baby's development.
Absolutely. They're like little windows into the nervous system.
Yeah, like the rooting reflex.
Yeah.
When you stroke a baby's cheek.
Right. And they turn their head and open their mouth.
Yeah, like they're looking for food.
Exactly. It's essential for breastfeeding.
It really is. And then there's the grasping reflex.
Oh, that's a cute one.
I know, they just grab onto your finger.
And they hold on tight. It's amazing how strong their grip is.
I know, it's surprising. Now, the Moro reflex, that one can be a little startling.
Yeah, especially for new parents.
It is.
Yeah.
Can you remind us what that one looks like?
Sure. So when the baby feels a sudden loss of support,
Okay.
Or here's a loud noise.
Right.
They'll throw their arms and legs out.
Yeah.
Spread their fingers.
It's like they're startled.
Exactly. It's a primitive reflex.
Okay.
Probably a survival mechanism from way back when.
Wow. That's fascinating. So these reflexes, they're not just cute.
Right. They're important for assessing the baby's neurological development.
So if a reflex is absent or weak or asymmetrical?
It could be a sign of a problem.
Right. So that's something we need to watch for.
Absolutely. We need to document our findings carefully.
And intervene early if necessary.
Exactly. It's all about early detection.
Now, besides those reflexes, what about the baby's behavior?
Well, newborns go through these predictable behavioral patterns.
Oh, right. You mean like those periods of reactivity?
Yes, exactly. It starts with that first period of reactivity.
Okay, when they're alert and awake.
Right, they're ready to interact.
So it's a good time for bonding.
It is, and for breastfeeding.
And then they get sleepy.
Yeah, they enter a period of decreased responsiveness.
Right, like they need a break.
Exactly. Both mom and baby need some rest.
And then they wake up again.
Right, that's the second period of reactivity.
Okay, and they're more alert and active.
Yes, and they might be fussier too.
Okay, why is that?
Well, their digestive system's getting going.
Right.
They're starting to pass meconium,
Right.
so there's a lot going on.
So it's a time for parents to really learn their baby's cues.
Absolutely, and to practice those soothing techniques.
Like swaddling and shushing.
Exactly, anything that helps calm the baby.
Now, what about those other behavioral responses?
You mean like orientation and habituation?
Yeah, and self-quieting ability?
Those are all important signs of a healthy newborn.
Okay, can you explain those a little more?
Sure. Orientation is their ability to focus on stimuli.
Like a face or a light.
Right, and habituation is their ability to tune out repetitive stimuli.
Okay.
Which means their brain is learning.
Oh, that makes sense.
And self-quieting.
That's their ability to soothe themselves.
Like sucking on their hands.
Exactly, or just falling asleep on their own.
So if a baby's struggling with any of these things...
It could be a sign that something's not quite right.
Okay.
And we need to investigate further.
So it's all about paying attention to those little details.
It is. It's amazing how much we can learn just by observing.
It really is. Oh, I think we've covered a lot of ground today.
We have. We've explored so much about a newborn's transition to the world.
From those critical first few hours.
Right, the golden hour. To those fascinating reflexes.
And those unique behavioral patterns.
It's been an incredible journey.
I agree. It's so rewarding to witness this transformation.
It is. Before we go, do you have any final thoughts for our listeners?
I do. I'd like to leave everyone with a question to ponder. We've talked about how some reflexes disappear as babies grow.
Right.
But what happens if a reflex persists longer than expected? What could that tell us?
That's a great question. I encourage everyone to keep learning and exploring.
Absolutely. There's always more to discover.
And remember, you can find more resources on our website.
Yes, be sure to check those out.
Thank you so much for joining us on this deep dive into the amazing world of newborns.
It's been a pleasure.
Until next time, keep those curious minds engaged.
And those hearts open to learning.
We'll see you soon.